If you're a loyal viewer of Sunday Morning, you know we spend a considerable amount of time covering the arts, which it turns out may be good for your health, as Dr. Jon LaPook explains.
Excellent. Could I just look at one other really quick moment?
Lear deBessonet is not a doctor, but these days she thinks a lot about public health.
There was a time that we in America didn't realize how important a seatbelt was in a car, or we didn't realize how dangerous cigarettes were. But I don't think it's well known that the arts actually impact your physical health.
We have an opening for the princess.
deBessonet is one of Broadway's most sought-after directors, and now the incoming artistic director for Lincoln Center Theater. Her reimagining of the 1959 musical Once Upon a Mattress, she's here with actor Michael Urie, struck an emotional chord.
Good.
So why, when watching a comedy, when everybody started singing, did I well up with tears today?
I know. I have that effect too. You know, I think there is something so deeply human about gathering, about telling a story, about laughing. And then let's see if we can just organically make that happen.
After years of directing, deBessonet began to notice that some of the actors who worked with her saw mental and physical health benefits.
I would see a person who got a diagnosis from their doctor that they had just had a stroke and would not be able to return in time for our production 6 months later. And you know what? In 6 months, they were on that stage.
We have people in all 18 places that are there that are...
deBessonet turned her passion for well-being into a national event. Last summer, thousands of people at 18 sites across the country took part in Arts for Everybody.
Art for everybody.
For everybody.
A celebration with the message, the arts can help create healthier communities, especially important at a time when loneliness is so rampant. Here she is leading a parade in the Bronx, New York, followed by a street fair.
Some people who we've told about the story have said to us, is this real?
I get that question a lot, and that's why I think it's important to point to things like the World Health Organization having 3,000 studies of the connection between arts and health.
Research suggests the arts can promote healing from illness as well as protect against a myriad of problems, including cognitive decline, heart disease, anxiety, and depression. Scientists are exploring the cellular mechanisms and brain wiring that might be involved.
Our life is grand.
But some things don't need to be understood to be appreciated.
Gray skies are gonna clear up. What would you say?
Put on a happy face.
There you go.
Like the ability of music to connect us and make us smile.
And why does that emotional connection improve our health?
And we know that we're more than flesh and bones. We're more than our bodies, right? And our soul needs food too.
I can prescribe penicillin. I can prescribe the arts, culture. How do I actually do that?
In the same way that it's very natural for doctors to recommend exercise to a patient. Exercise isn't medicine, it's lifestyle, but it has real health impacts.
It's called social prescribing, the idea that arts, culture, and community can be medicine.
I think that participating in the arts does so much for us physiologically, cognitively, socially, spiritually, and uniquely. It does all those things all at the same time.
Jill Sankey is the founding director of the Center for Arts and Medicine at the University of Florida.
We know now that there are arts programs in about half of hospitals in the United States. Mostly we hear that patients discover unexpected joy in a very difficult moment of their lives, and that can be really transformational.
Is it being introduced to medical students, first year?
It is. Studies have shown that 75% or more of medical schools around the country are engaging the arts in medical education.
The idea of prescribing the arts to improve health is gaining momentum. For example, in Massachusetts, a new statewide initiative is connecting more than 300 cultural organizations with healthcare providers. Also spreading the word, a national group called Social Prescribing USA. And earlier this month, the Federal Reserve Bank of New York held an event exploring the potential economic benefits.
I think that what we have been doing in the past hasn't gotten us very far. Our health outcomes are not great. Our healthcare costs are immense. And so we have to be open to innovative, new things.
Paloma Izquierdo Hernandez runs Urban Health Plan, which serves 90,000 people at 26 Bronx community health centers.
Our community is one that has been underserved in many, many ways over many, many years. So bringing innovative programs to them, you're giving them the opportunity to make real impactful changes in their lives. And some would never get that opportunity.
I really can't explain it, but there's always a different way of connecting with stuff.
Therapists at Urban Health Plan recommend a number of classes to help Rosie.
We're either cooking class, the writing class, the reading class. There's always something special about it.
Do you have any thoughts about whether it's more beneficial to your health to just sit there and observe art or culture, or to actually participate in it?
You should do all the things you can do, to engage.
Nataki Garrett is Arts for Everybody's co-artistic director.
Anything that makes you stop, slows you down. Write your stories, go see a play about somebody else's story, sit in the park, listen to free music, come home and sing songs to your own children. It's all about having that connection.
Don't feel like you have to be good at something in order to get physical benefits from it. Sing badly, dance badly.
I can do that. I can do both of those.
Yes, but sing and dance freely.
Yeah.
Yeah, just do it. It's a just do it kind of thing.
For Lear deBessonet and her Arts for Everybody team, the healing power of just doing it is no leap of faith.
I've seen it, I've lived it, and that's why I believe in it.